Hi everyone, it's Susanna and I'm back to tell you about our monthly special. For the month of September, we will be offering 25% off any facial vein treatments. The number one reason why we see veins through the skin on your face, number one reason is hereditary. That's something that's just handed down through the generations. Lighter skin types are much more predisposition to veins showing through their skin as opposed to a darker skin type where the veins just don't show through as easily. Alcohol consumption can also encourage vascularity to show through the skin. Sun exposure is another reason why they will become more apparent, and also hormones can affect veins showing through the skin. We also do leg vein treatments. That isn't part of our special this month, but I like our patients to be aware that it is something that we can treat here. There are certain types of leg veins, like varicose veins, that I cannot treat, but generally the smaller blue or red veins in the legs can be treated with my laser treatment or my hyfurcator treatment here. So this is my lovely patient, Debbie, and we will be doing a couple different types of treatments on her tiny spider veins that she's got on her cheeks. So this is our Cyton laser 3mm handpiece. This treats veins and it also treats hair, and obviously today I'm using it to treat facial veins. The tip of this is chilled, so it'll feel like ice against her skin, and then once we start working, she'll feel some zapping sensations. Some patients describe it as a bee sting feel. You okay?
Mm-hmm. Makes it nice that it's cold.
Yeah, it's definitely to help keep you a little bit more comfortable. Are you feeling that very much?
No, not at all. The areas where it's more fat,
You think you're
it hurts
feeling
less. Yes.
So basically, after the treatment, the area will be a little bit red. It's also possible to get bruising after a treatment like this, but we generally get bruising if we have a densely clustered area of veins. Debbie's are so tiny and there's so few of them that I don't anticipate her getting any bruising, and the redness may last a few hours and then her skin should look back to normal. You can wear makeup immediately after. There's really no aftercare because the skin is left intact, so really just a little bit of redness to expect after the treatment. Are you feeling any discomfort right now?
None at all.
So it's really just while I'm treating, right?
Yeah, I mean, it's not even bad at all. It's just like a little pinprick.
Okay.
That's what it feels like.
Okay.
Not as much as a bee sting.
Okay, good. So and the outcome with the hyfurcator is much more predictable from my experience than what I get with the laser. They're both great, but I tend to treat more with the hyfurcator. Basically, this is just emitting an electric current through this needle, and that goes into the vein and it basically shrinks it. So this will feel a little bit different than the other treatment, Debbie.
Okay.
Feel that?
Yeah, that's like a bee sting.
Okay. Here. Okay. Basically, the vein will blanch.
Okay.
And
Amazing what they can do nowadays.
Yes. There'll be a little bit of redness in the surrounding area after, which again, it'll last a couple hours. It doesn't last very long. But with this treatment, along with some temporary redness, a couple days out, she may form some little tiny scabs. They'll be like a little red dot. They're going to be very, very small, but it's something that we get with the hyfricator because the skin in the area that I treated is actually being singed a little bit. So that's the difference between the two treatments, is she will get a little dot of redness. That'll last about a week, possibly 2 weeks tops. After a few days, she can wear makeup over the area to camouflage that redness. But in the first day or so, I like to leave the area clean so that it doesn't get contaminated with any kind of product.
Can you use face wash?
You can.
Okay.
You know, general morning and evening washing is fine. Your basic moisturizers are fine.
Okay.
You don't want to use any products that promote cell turnover, like glycolics or retinols, Retin A, your tretinoin creams, because essentially what you'd be doing is opening up the area that we're trying to have close up. It's a very small poke mark, but you want that area to be allowed to heal on its own without that irritating disruption from harsh products like those.
Okay.
So you're feeling, how do you feel now?
Perfect. It doesn't even
Okay.
hurt at all.
So again, the discomfort is really just while we're working in the area. And as you can see, it's a little bit red right now, but that will go away fairly quickly, I'd say within the next few hours. And then the red dots that will be apparent won't actually show up for a couple days. So that concludes our demonstration of our laser treatment for veins, also our hyfricator treatment for veins. And if you have questions that perhaps I didn't answer here, please feel free to give our office a call, 800-493-3223, and you can either book a consultation or we can possibly help you with questions over the phone before you decide to come in and take advantage of this treatment.